Good afternoon again. I'm Kathy Bryant. I'm with TMLT's Product Development and Consulting Services. And on behalf of TMLT, I'd like to welcome you to COVID-19 Medical Liability Frequently Asked Questions. We want to thank you for joining today's webinar. TMLT is committed to helping physicians and their practices get answers to questions related to COVID-19 and medical liability. We hope that you will use the Q&A pod on the right to enter your questions as we go through the webinar. And if your question has not been addressed during the webinar, we will address it at the end when we take questions. Also, on the lower left-hand corner, the downloadable files are there for you to use as reference. The first two are Texas Medical Board Frequently Asked Questions, and the third is a copy of today's slides. Today I'm joined by three other persons from TMLT. David White, a regional manager in our claims department. Cassie Turner, a senior risk management representative, and Marshall Wyatt, the assistant vice president of underwriting and business development. As with all of our webinars, we're presenting information. We're not attorneys and we're not presenting legal advice. And we would just remind you that in this very rapidly changing environment, especially as it relates to COVID-19, that Texas and federal response and guidance is rapidly changing. And we would like you to know that this information presented in this webinar is as up-to-date and accurate as we can get it on March 24th, 2020. In this webinar, we're going to discuss medical liability concerns related to COVID-19. We're going to discuss rapidly evolving changes and many of the common questions that TMLT has been receiving over the last few days concerning COVID-19. As always, we want to point you towards reliable sources of information. And we have hyperlinked for you the CDC, the Texas Department of State Health Services, the TMLT Resource Hub, and Texas Medical Association's COVID-19 websites. We came across this particular graphic, and we wanted to pass it along. It may be of help to you and your staff as you're getting questions. But it's based on a research article that about how long the coronavirus can persist on hard surfaces. So we're going to start by talking about some of the Texas Medical Board changes that come out almost every other day. It seems like we're getting some update from the TMB. So Cassie, would you start out by helping us understand more about doctors who are coming to Texas to work from other states?
Sure, thanks Kathy. So in response to the pandemic, Texas has allowed Texans physicians from out of state to get a temporary emergency license. This license would be valid for 30 days or until the disaster declaration has ended. Hospitals still do have some due diligence, which you can see here as far as verifying credentials and also notifying the board within 10 days of those new physicians who are going to be practicing in their facility, as well as notifying them within 10 days after those physicians have stopped providing services or practicing under this section. If you have specific questions, there is an email there you can send your questions to regarding physicians from out of state. Again, if you know of someone who would be coming from out of state, they may ask you as a Texas physician to sponsor them. This requires a sponsor of a physician in Texas, and there is a link here on this page where that application for a temporary permit can be accessed and submitted to the board for approval. So Marshall, would you tell us how this would impact TMLT insureds working out of state, that those of us that are actually here in Texas? And I think you're going to need to unmute your speaker, Marshall.
Good afternoon. For doctors that are moving into the state, we need to have them become licensed by the TMB here, and we would typically ask them for an application. It's a short form, and we can expedite that in this time. And the doctors here also must be members of the Texas Medical Association, so we would look at that also.
Great. Thank you very much, Marshall. So additionally, Texas is encouraging physicians who have been retired to apply for licensure, particularly those that have been retired for less than 2 years. There is an application where you can apply for licensure. If it's been more than 2 years, this does not mean that you should not apply. It just means that the application will be reviewed by the licensure committee of the board. Obviously, licensure cannot be under investigation, under board review, or restricted at this time. But again, there is additional information and links here if that applies to you, or if you know of someone who is retired and looking to reapply and get their licensure back. And as we've mentioned with TMLT, the state is expediting licensure, so they're moving these through pretty quickly so that there is not a holdup to be able to get out-of-state professionals in place to respond to the pandemic. One question that we've gotten a lot, and one that actually Governor Abbott has put out a statement on, is management of chronic pain. The board had put out a request, and Governor Abbott has said that any established chronic pain patient can have a refill to ensure continuity of care. This will be suspended as of right now, April the 10th, 2020. So until that time, any established pain management, medications can be prescribed via just a telephone request refill. They do ask that the standard of care continue to be met, as well as documentation requirements need to be met for pain management, just as they would be during any other time. So taking action to limit prescriptions of potential coronavirus treatments, you all may have heard that there are some potential treatments, and so we as Texas are being asked to limit the number of prescriptions for those potential coronavirus treatments. So you will want to make sure that you're limiting those, and particularly those that are in short supply and demand due to this outbreak. This also goes in if you are treating any family members or staff. Make sure that you are documenting according to Chapter 165 of the TMB rules. All of that still applies, even though it is a special circumstance, as well as writing prescriptions. The one thing to note here on this slide, while it is wordy, is that immediate need for controlled substances, if it's family, staff, or physicians treating themselves, it's no more than 72 hours that can be prescribed. So just keep in mind that there are some relaxation here of some of the guidelines for treating family, staff, and yourself. However, you want to make sure that you're adhering to Chapter 165 and that you're also limiting prescriptions of those potential coronavirus treatment drugs. Guidance for non-urgent elective surgeries. We've gotten a lot of questions on this as well, and the board has put out a FAQ, which we've put down in the downloadable file section for you to download. So anything that is an anticipated short-term or long-term negative impact, where there is no anticipated short-term or long-term negative impact, by delaying those inpatient and outpatient settings are going to be delayed. And I would like to ask David, for your input, David, as a claims regional manager, if you have any thoughts further on postponing non-urgent elective surgeries or procedures and the impact from a claims perspective.
Well, I mean, I think that it's something that everybody's going to need to do, obviously. The only thing that really comes to mind for me about a potential risk factor on this particular issue is, designating things as whether or not they are non-urgent and elective as opposed to urgent and non-elective. So I think that's going to be the main issue. If you're pretty comfortable that something qualifies as a non-urgent and elective procedure, then I certainly think it can be postponed.
Great, thank you so much, David. And again, we do have that FAQ there for you to take a look at. The idea here is that we're preserving staff, supplies, and trying to limit the spread by not going forward with non-urgent elective surgeries and procedures, inpatient and outpatient. So again, here's a question that we received prior. It says, do outpatient elective procedures count towards those procedures that are prohibited? For example, such as a lipoma removal done in an outpatient clinic that uses sterile gloves only and a blue mask for PPE. Again, I think that the guidance is non-urgent. Elective surgeries are all postponed, inpatient and outpatient. Kathy, if you had any more to add there, I will let you go ahead and do that.
No, I actually had a chance to visit with an attorney that works with TMLT policyholders, and they thought this was a pretty cut and dry response.
Okay.
Likewise, another question that we've gotten is from a pain management group asking whether injections should be continued during this time. The issue is that some patients can have worsened pain and end up in the ER, which would be a burden. I know that some of these become a judgment call. Is there going to be time, or is there a place that this can safely be done, and can you get the supplies? So, Cassie, do you have anything else to add?
No, I think, again, as you mentioned, discussing with one of our TMLT attorney consults, it seems, fairly cut and dry, but this is the information. Again, continue to check back at TMB and other resources as we continue to update information as we get it.
So probably one of the hottest topics that we've been getting questions about is telemedicine. And I will just tell you that my discussion with the attorney this morning was that he believes there are still a lot of gray areas in the telemedicine guidance that has been put out, particularly in Texas. And we hope that over the coming days that more guidance will be forthcoming.
So, as Kathy, yeah, go ahead,
Kathy. No, I was just going to say, do you want to tell us more about what Governor Abbott
So,
has
Governor
said?
Abbott, in response to a TMB request, has loosened the telemedicine guidelines and rules, if you will, and telephone or telemedicine consults now may be used to establish a physician-patient relationship. This will be in effect until the disaster declaration has been ended. And we also have an FAQ again for you here that's in the download file pod to the bottom left. If you have some specific questions, this TMB, frequently asked questions, outlines quite a few of those that may be helpful to you. But again, you can go ahead and establish a patient-physician relationship, you will want to make sure that you're maintaining an adequate medical record, that documentation requirements remain the same, just as we mentioned with pain management earlier. These will remain the same. This is some of the FAQs that are found within this TMB notice, so if those would be helpful to you, then we would encourage you to go ahead and download that document. We won't go through each of them just out of the sake of time, but Marshall, I would like to ask you if you could speak to TMLT, telemedicine coverage, waivers, etc.
Sure. The TMLT policy will cover for care provided via telemedicine. For Texas physicians who are physically located here and are providing care within the state, the coverage is built into the policy. They can do that. There's no problem with it. And again, as Cassie said earlier, the record-keeping requirements and everything are still the same. For doctors who are treating out of state, who are reaching out to patients, say in Colorado or somewhere like that, it becomes more complicated because, number one, the doctor needs to be licensed in those states too, and some of the states have different requirements as far as coverage limits or other coverage issues. So we would ask, if you're trying to treat patients out of state via telemedicine, that you contact your underwriter, and we can address all your questions at that time.
Great. Thank you, Marshall. Again, here's another question that we've received. How does a physician get a patient's consent if using telemedicine? A patient can give consent to participate in telemedicine, either written and or oral via telemedicine. This must be documented into the patient's medical record. So if they give you a verbal, just document verbal obtained to participate in telemedicine or something along those lines. If you wanted to do something written, obviously you could push that out to your patient portal potentially and have the patient sign it there. Another question, we are trying to work a new telemedicine vendor. How important it is to have language around substance abuse and mental health included. One vendor does not have this in the BAA. Some things to consider: telemedicine, Hipaa, mental health. For your BAAs that you put in place. If you do decide to do telemedicine outside of a telephone, we would recommend that there is a BAA in place. Kathy, would you like to add anything regarding this question?
Yeah, this was one of the specific questions that I discussed with an attorney this morning. And he felt like as long as you were operating within the telemedicine requirements that were put forth by Texas and the relaxed guidance of Hipaa, that you would be okay. But just be sure and use those be sure and choose the application that you're using wisely. And I think we have a slide on that a little later. Here is the slide. So the question is, what apps can I use to do telemedicine under the notification of enforcement discretion for telehealth remote communication during COVID-19 nationwide public health emergency? That comes direct from the OCR website. And the answer is you can use things like Apple, FaceTime, Facebook Messenger, video chat, Google Hangout, video, Skype, all of which you're not going to get a business associate agreement, but they are allowed during this emergency time. However, it does go on to say things like Facebook Live, just the plain Facebook Live, Twitch, TikTok, or other similar video communication applications that are public-facing should not be used in the provision of telehealth by covered health providers. So I think the warning is some of these things can't be controlled to just the two people or the people involved in the Apple FaceTime, for instance, whereas some of the other ones listed below in yellow really are meant for wide distribution. So Cassie, do you want to talk about TMLT's policies and telemedicine? We've already covered some of
We
this.
have, and Marshall covered this, and I think that we will just move forward in that there is coverage for telemedicine visits, as Marshall mentioned. If you're looking for something out of state, or you have a license in another state, or you have a patient in another state, please reach out to your underwriter or your medical malpractice provider, if it's not us at TMLT, to make sure that you do have the appropriate coverage. Marshall, would you like to add anything more?
Yes, I did have one other thing I failed to mention earlier. When you're providing telemedicine care, it's really the expectation of TMLT or Lone Star Alliance that the care you're providing is within your area of training. I know at this time a lot of doctors are being asked to do a lot of different things because of the shortages of care providers, but we want to be sure that people are working within their area of expertise.
Great, thank you. That's a great reminder.
Here are just a couple of other quick screenshots to remind you there are a lot of telemedicine resource pages out there. The Texas Medical Association has one that they are updating probably every day with new information as it becomes available. Also, the AMA put out some guidelines on telehealth earlier this week, and I would just suggest that when you have time, these are all live links, even in the PDF that you're going to download, and that you can certainly just review those as they're appropriate for your practice.
And one thing I'll mention on those resources, Kathy, if you don't mind if I jump in, if you've not participated in telehealth before, I've gotten a couple of calls of folks who have not. There are some really good resources on those websites, some fact sheets and some tips for getting started with telemedicine, how to choose a vendor for telemedicine, and some basic policies and procedures to consider as you maybe launch into telemedicine for the first time.
Thanks. This is another bit of guidance that the OCR issued just 4 days ago on telehealth remote communications, and it's a bit of it's not concern, but it is a bit more information. Again, there are links that can be found on this the websites that are listed, and if you have any trouble getting to any of those, you can reach out to us and we'll help you get those live links. Again, Medicare has issued a significant telehealth FAQs. The title there at the top in green is actually a hyperlink to the same website that's listed below. But if you have a large Medicare population, you may want to check out the Medicare telehealth. They even have some coding tips for billing on that frequently asked questions page. Second, probably only to telehealth, the questions we're getting seem to involve employer or employment questions. Just a little reminder, again, like I said in the beginning, we're not attorneys, and we do have limitations, so we are going to answer some of the most frequently asked questions as best we can, but no, again, that this may be something that you may eventually need to take up with a labor law attorney. So Cassie, you want to talk a little bit about the CDC
Right.
guidance on getting your clinic ready for coronavirus?
So here on the CDC website, which I'm sure many of you have already visited, they have quite a few resources that are specific to practice management and getting your clinic ready. They just provide some handouts here of what to do before patients arrive, when patients arrive, after they are assessed, and training for your staff. They also offer some downloadable resources that you can print for in your office or outside of your office to just let people know how they're supposed to respond and proceed. So just some pretty good information there for you to look at if you're looking for information for your specific clinic and making it ready or not, I guess, is where we're at now.
This is just a screenshot of the Texas Department of Health, or I'm sorry, the Texas Department of Insurance's website, their coronavirus resource page. Specifically, this is pointing out links to workman's compensation questions and OSHA questions, and I thought that might be helpful just for you to have one place that you could go to link to those important resources when it came to employment. So speaking of workman's compensation, does workman's compensation cover coronavirus-related exposure or illness? So according to the Texas Department of Insurance's website, workman's compensation is an insurance program that pays for medical bills and some lost time for employees who have a work-related injury or illness. To qualify, an employer must have workman's compensation insurance, and an employee must have been injured or contracted an occupational disease as the result of their employment. Whether or not a workers' compensation claim is compensable or not is a case-by-case determination by the insurance carrier. And then it goes on to talk about disputes. I would say at this time, this one is not very clear as to how workman's comp is going to rule on COVID-19 infections of specifically healthcare workers or employees in physician offices. We all know that there is a huge shortage of face masks and other personal protective equipment. We've given you a link to a fairly lengthy document on the CDC website specifically addressing face masks. And basically, the document offers a series of strategies to optimize supplies of face masks in healthcare settings, especially when there's a limited supply. It goes through conventional capacity, contingency capacity, and crisis capacity. I think in many situations that we're hearing about, we're at crisis capacity, and that often quoted on the news media, the CDC is recommending healthcare workers wear bandanas, is actually found in that crisis capacity. So I would just point that out to you. I don't have a solution. None of us have solutions. But if this offers you some help, hopefully it will. So Cassie, we've had a couple of questions about personal protective equipment not being available or furnished by facilities. Would you like to handle
Sure.
this one?
The questions we've gotten are my liability for refusing to enter a hospital if there are no PPEs and therefore cannot appropriately protect me as a healthcare provider. Again, as Kathy's mentioned, these are scenarios that we don't have full solutions to, but we would recommend that you check your facility bylaws and our contractual arrangements just to make sure that you haven't agreed to help in the event of an emergency that would obligate you for some reason. And then also check the guidance of your professional society to see if they've put forth any responses about working without PPEs. We know that this is going to be ongoing. And again, please check back for updates on this because I think it's just going to be a continuing question that we have.
One of the questions that we have received is, does TMLT cover work-related injuries? We just put up a screenshot of part of our website about employment practice liability insurance, which is covered with all of your TMLT policies. But a note on there is that EPLI coverage is limited to claims brought against you by or on behalf of employees, former employees, or an applicant for employment. So most of these situations are not going to apply to a work situation where it's just a question of an infectious disease. So again, I'd remind you that we're not attorneys, but we have gotten so many questions about, do I have to pay employees if they cannot work? And we would point you towards the Family First Coronavirus Response Act that I believe went into effect on March 18th or 19th. That starts out by saying that the Act requires most employers with fewer than 500 employees to provide paid leave through December 31st, 2020 to workers who had to take time off because of COVID-19. And then there are very specific FAQs on this, and we bring this to you as a direct quote from a law firm of Vincent and Elkins that hopefully may answer some of your questions. There is a potential for exemptions for very small employers, employers that have fewer than 500 employees that may be exempt to the new requirements. The law allows the Secretary of Labor to exempt employers with fewer than 50 employees when compliance with the Act would jeopardize the viability of their business. However, there is no specific guidance on how you apply for that exemption or how those exemptions are going to work. So stay tuned. We know that this is something that we're going to have updated guidance on in the days ahead. But hopefully this will give you some reference to refer to as you're fielding questions from your employees. So this is a question we actually received this morning. The front desk receptionist employee walked out refusing to work for fear of catching the coronavirus. What is the practice's obligation to pay them for paid time off or job retention? Kathy, what are your thoughts?
Again, as we've mentioned with some of the other scenarios, is review your employee handbook, policies and procedures, and ensure that whatever you're putting out is in line with those policies and procedures that you already have in place. Again, there's going to be continued guidance coming forth from local, state, and federal governments, so stay tuned as well. And if you're particularly concerned, I would say consult with a labor attorney There are, as Kathy mentioned in the Families First Coronavirus Response Act, there are some parameters for workers to not work. So you would want to make sure that they fall within those buckets, if you will. Again, but we know that this is a bit of a moving target, and this seems to be changing. So again, stay tuned and keep looking for updates on your employees' situations.
We're going to cover some specific information related to TMLT. Oops, sorry. Kathy, talk a little bit about emergency relief work.
So for emergency relief work, TMLT policies generally provide coverage, and I am going to actually ask Marshall to jump in on these as well to provide some additional clarity given his expertise in underwriting.
Sure. The TMLT policy will extend to care you provide outside your normal practice. It's going to be automatically covered unless perhaps you're in a group situation, if you're in a organized group where the group has purchased coverage for everybody and there are specific limitations on your coverage for work outside the group. That's fairly common, so that's something you need to look into if you're an individual in a group and you're thinking about taking your time on weekends or something like that when you wouldn't normally be working for the group and work outside. So that's one thing to think about. But for the most part, if you're practicing within your specialty and you're providing care within the state, you won't have any problems with coverage under your policy.
Great. Thank you, Marshall. We also recommend that there's a little resource that we'll give you about stay tuned and stay connected so that you can check back as we get more updates on these scenarios.
Marshall, I'm going to toss this one to you since you're our underwriting expert, but TMLT policies do not cover business interruption.
Well,
you want to talk a little more about that?
The TMLT policy provides coverage for medical professional care, and the business interruption exposure is typically an exposure that's picked up by an organization's property insurance policy, or in some cases their liability insurance policy, their general liability policy. The cyber coverage that we have attached to the policies, it does provide some business interruption, but it's not going to be for this type of business interruption, that is interruptions caused by a disease. Normally a business interruption policy, whether it's under our cyber or under a separate policy like your property policy, is going to require some kind of physical damage to your property in order for coverage to be triggered. So if you have questions about business interruption and how it might impact your practice, be sure and talk to your agent or the organization you have your property insurance with, and I'm sure they can guide you with that question.
Thanks, Marshall. Thanks, Marshall. So, David.
Yes.
What should individuals do if they get a notice of a medical malpractice lawsuit, a Texas Medical Board complaint, a cyber incident, or even an EPLI lawsuit or complaint during the COVID-19 crisis?
So the best thing to do when you get any of these things, and it really is the same as it always is, it'd be just to call our 800 number, which is listed there, and speak to someone in the claims department. Anyone here in the claims department can help with any of these calls and get you to the right place. We do have a fax number listed there as well, or you can fax the documents that you've received, either that or email. We don't really give out a general email address, but the person you're speaking to can give you his or her personal email address that you can email documents directly to that person. And we would ask you also to hold off on faxing or emailing us any medical records unless we ask for those.
Thanks, David. As Cassie mentioned, TMLT wants to stay connected with you and you connected with us through these uncertain times. Whether you have questions on how to prepare your practice for COVID-19, we want you to know that we're here for you, and we've provided you with a number of the standard or usual resources that we have provided earlier in the webinar. Additionally, you can connect with us through Facebook, LinkedIn, or Twitter, or use our resource hub as well. We also wanted to remind you that you can find a link to all TMLT departments on our website, or calling the 800 number that David mentioned. And we've listed a couple of our specific departmental emails for you: customer service at tmlt.org, risk email at tmlt.org, and underwriting at tmlt.org as a few helpful links that you may find those easier than to place a phone call. At this time, we're going to open up for questions. David and Marshall, y'all might want to go ahead and unmute your microphones, and we may toss questions to you as we come to them.
Good.
So the first question is, what is PPE as defined by Governor Abbott and the state of Texas? As far as I know, Texas has not issued any special definition of PPE. PPE stands for personal protective equipment, and that is often referred to, or that definition, I would say the most reliable is found under the CDC website, or even OSHA has a definition as well for personal protective equipment. But I do not think there's a specific state one. Just taking a look at some of these, I think coverage for telehealth has been covered. So TMB clearly states that the standard of care in telemedicine must be met. What is the standard of care for telemedicine physicians during the coronavirus pandemic for a patient with fever, cough, shortness of breath, chest pain, if physician offices and urgent care clinics are closed, and if ERs only can see critically ill, the ones who require oxygen fluids, the ones being triaged for ventilators? We can't really tell you what the standard of care is. David may have some comments on this in a moment. However, I think in extreme situations, you are really faced with doing the best you can. If there is not a place to physically go in and see a patient and lay hands on a patient to diagnose them. So using telemedicine is maybe the best and safest option at this point. And I would just encourage you to document everything that you possibly can to adequately show that you have done the best you can in the situation. David, do you have any other comments on standard?
Yeah, I agree with that. I think doctors are going to have to rely on their training and education and their judgment on what the standard of care is in certain situations. But I think it's a good thing to also keep in mind that in the context of a healthcare liability claim, what will ultimately be asked of a jury to assess is whether or not the doctor did what a reasonably prudent physician would have done under the same or similar circumstances. So the standard of care is not always going to be the same. It can be a moving target, and there's never been anyone that's said, as far as I know, that the standard of care is the same today as it's always been, or that the standard of care for telemedicine is the same as seeing a patient in the office. So I think the key terms to keep in mind are reasonable and under the same or similar circumstances.
I'd like to add to that also. I think that's really good. But I'd also like to add, part of the requirements for doing telemedicine is maintaining records. And the maintenance of records, especially in a time like this where there's a lot of things going on and rules are changing and situations are changing, the records, keeping good records is absolutely essential to provide the best defense possible for your providers.
Thanks, Marshall. I see that one person has raised their hand. We're really not going to be able to unmute your microphone and let you ask a verbal question. So if you could type it in the Q&A pod, that would be great. Another question is, what are the recommendations if a provider or nurse becomes COVID positive, the recommendations for other staff or and patients? I would refer you to your local health department, whether that's city or county health department, so that they can do the epidemiologic forensics, so that they can do their job to trace contacts and make recommendations on that as well.
And Kathy, I'll add too, the CDC has, if you go to their website, there's actually a specific FAQ and flyer that speaks specifically to steps to take if my employee tests positive.
Thanks, Kathy. Kathy, do you want to address how about patients with severe pain in need of a knee or shoulder arthroscopy?
This is one that I think that, and Kathy, you spoke this morning with one of our attorneys, that if there is not going to be a short-term or long-term negative impact by delaying, that is the recommendation. And again, inpatient and outpatient settings, I think there's going to just be a delay, unfortunately. I think trying to obviously manage pain as best you can in the interim, but certainly David or Marshall, if you have something to add from your perspective, please feel free to do so.
Yeah, I think it's a judgment call. If it gets to a point to where the pain is so extreme that it's no longer considered elective or non-urgent, then I think that could potentially change the scenario. So I think it's going to have to be a case-by-case judgment.
Yes, I agree.
The next case or question is actually similar, or on the similar topic. What happens if a doctor decides to do a non-urgent surgery? If all goes as planned, no problems, right? My understanding is that you probably are not going to be able to schedule that in most facilities. I think facilities are going to be the ones that are ultimately going to be deciding with the physician what can and cannot be scheduled. Now, if you're talking about a procedure, a minor procedure that's done in your office, I don't know what will happen if you go forward with a non-urgent surgical procedure and everything comes out fine. David?
No, I think that sounds fair, particularly if the patient that's getting the procedure doesn't have any complications. I think that's very unlikely that particular patient would file a claim of any sort. I suppose it's the reverse that's a potential issue. If the non-urgent procedure is done and there is some sort of complication, then the question would be, is that related to what's going on around us? And that would be the only thing I can think of.
Thanks, David. Are pediatric quick care / after hours clinics supposed to remain open? I'll take the first stab at that one. I think that most of the counties and cities that have issued either stay at home or shelter in place orders have been fairly clear on we need to make sure that those that clinics are exempt. Now, I guess the question is, are employees, or not employees, but are patients wanting to come into the clinic? If you're not getting, if you don't have the volume, or if you don't have patients wanting to come into the clinic, that becomes a judgment call on whether you keep your clinic open or how you do telemedicine and meet the needs of your patients. Other thoughts?
No, I don't think there's been any clear, as you've already mentioned, Kathy, yes or no judgment.
So in West Texas, we have a lot of New Mexico patients who normally travel to the Lubbock area for care. Would TMLT cover exposures for treating these patients via telemedicine? Marshall,
Okay,
I'm going to toss that one to
well, this
you.
is a good question. There's a lot of issues to consider here. First of all, the TMLT policy would extend to care for patients in New Mexico, but there's a couple of caveats there. New Mexico is known as a patient compensation fund state, which means if you participate in the patient compensation fund, which requires a separate policy that's written just for New Mexico, you get certain legal protections that you don't get if you do not participate. So if you choose not to join the patient compensation fund, you're practicing via telemedicine with the TMLT policy in, say, Lubbock or Amarillo or El Paso, you could be exposed a little bit more than you might be otherwise. New Mexico has not shared anything that I'm aware of yet about how they're going to address telemedicine in this particular outbreak situation, so they may be relaxing their rules and accepting that if telemedicine is provided from a Texas location, that they will allow claims to be managed as if they were filed in Texas. So we're just going to have to wait and see what's going to happen with that. But what I would suggest in the meantime is if you have some doctors who are going to be providing care via telemedicine to New Mexico, to contact your underwriter and reach out to us, and we'll look at those on a one-by-one basis. And I think that's something that will be changing very quickly in the next few days.
I think you're right, Marshall. I think more states are going to come along and continue to issue guidance. Next question is also on telemedicine. What does oral telemedicine consent sound like? What keywords might be stated to legitimize the consent. I have not seen anything that specifically says what needs to be included in a consent. If they're an established patient, you may already have a consent in place, but the caveat would be that if you're calling a patient and saying, in lieu of coming to the office, I'm going to treat you over the telephone, do you consent to that? And getting a yes, and then you document whatever question you asked. I think that would be sufficient. David, do you have a thought, or Cassie?
No, I agree with what you've put forward.
I do too. I think we're all kind of just doing the best we can with some of this. If there is an issue that you would actually give a form if you were treating a patient in the office, then I think you could just read that form verbatim for anything of that nature.
And then there's actually a follow-up question. Is this consent to legitimize billing for this type of care, or for what other purposes? I don't think it's billing at all. It's a requirement of the Texas Medical Board under the telemedicine guidelines and rules that they have promulgated. And I would just refer you again to that Texas Medical Board Telemedicine Frequently Asked Questions. There is some discussion in that document about that.
I'm not 100%, but I think that some of this could be because of the establishment of a patient-physician relationship where consent has not ever been provided in the past. So I think, as David mentioned, maybe reading what you already have in place and having the patient consent to that would, if you're establishing a new patient-physician relationship, would be sufficient.
Sure. This question is about outpatient pediatrics. Would 2-week newborn well checks, mandated vaccine checkups count as medically necessary visits? Also, will they need some kind of note to be driving on the road to come to the office? I have not seen that in any of the stay-at-home orders that I have reviewed. If it's just for those those newborn checkups, could that possibly be done with a telemedicine visit? I would just suggest that if you have a stay-at-home order in your area, that you check with the details of that order and make sure that the patient, that they don't have some sort of requirement that you have to show proof that you're going to a clinic. If a city or county goes on shutdown, lockdown, stay at home, shelter in place, are we supposed to be closing down our office and not even have employees come in? Cassie, I think we spoke to that
but I
earlier
think we
today.
have.
But again, that's not something that we have a clear answer on. I think it's based on the needs in your community and whether patients are needing to be seen in your clinic. What is my liability as an employer if I cannot provide PPE for staff and one contracts COVID-19? I would refer you back to that, specifically the face mask guidance from the CDC. And, honestly, I don't think any of us know what liability we may have, or any of you may have, for this crisis. Any other thoughts?
I think it's evolving.
Yeah. What liability do we have if a patient is refusing imaging or diagnostic testing during this time, causing a delay in diagnosis? First of all, you need to be documenting very carefully that the patient is making that decision to delay the imaging or the diagnostic testing, and that you have offered the capability for it. But I don't think that there is anything else that we can potentially add. Do you, David? If a patient.
No, I think documentation is very important. Obviously, that you've had the discussion with them, potentially even what the consequences of not getting the test and coming to a diagnosis would be. Just kind of think about that as far out as you can, and the more documentation, the better.
What about minor or urgent care issues that can be done at the PCP's office to avoid having a patient go to the ER? I think as long as your clinic or minor urgent care is open and you can safely see the patients, I think that that's reasonable that you direct patients to that. How do billing companies protect themselves with Hipaa compliance when forcing employees to work from home? Is Hipaa laxing rules and regulations due to 100% of the workforce reductions in, I guess that's NYS, is New York State? My thought on that is that I do not specifically know what New York State has or has not done, and I would address that with your insurance or a Hipaa attorney in your area. I have not seen any guidance from Hipaa that relaxed anything on the Hipaa rules. As far as work from home, you should potentially have policies in place that cover how that is going to occur if that is happening in your business. One of the things that I have not mentioned is that if you have specific questions that we don't get answered because we only have a few more minutes, that you can continue to email questions to consulting@TMLT or any of the other department-specific emails that are shown in the slides. But at this point, we may not be able to get through all the questions. So please feel free to continue using those resources, as well as checking back frequently and making sure that what new things we get information on will be posted on our website. If insurance denies a telemedicine claim, can we bill the patient? What about Medicaid? Cassie, do you have any thoughts on that?
I believe that the Medicaid has put forth information on specifically telemedicine billing and has addressed that already up front, and they've also created some specific CPT codes that you should be billing under. You can find that information on the TMA website as well. There are some good resources for billing specific to telemedicine and CPT codes that you should be using.
Thanks. Yes, and TMA is a great resource if your providers are TMA members as far as billing questions. They have some great expertise over there on that. TMLT offers coverage for contiguous states. Is the coverage in place for providers offering telemedicine in contiguous states where they are licensed. I think we've already covered that question. Marshall, do you have anything else you want to add?
Yes, we touched base a little bit on the New Mexico exposure, and it is covered, provided they're licensed there. I don't think we have any trouble at all. Again, though, the New Mexico part is a little different because the exposure to the doctor is a little greater in New Mexico because of the lack of protections that they would have otherwise, but the coverage is there. So that's an affirmative.
Okay. This question is, do we anticipate seeing a limitation on liability for COVID-19 patients similar to the Willful Wanton standard for emergency care? I have not seen anything on liability limitations. It would not surprise me if we see something more coming out on this in the days ahead. David, what about from your perspective?
I think there is a movement at the federal level to address that. Now, whether or not that's come out yet, I don't know, but I do think that we may see something on that in the near future.
Certainly would make us all breathe a sigh of relief, I think. Does a doctor need to be in the same state as a patient for a telemedicine visit? Cassie?
Yeah, or I was going to actually, I know Marshall kind of touched on this earlier, that with the telemedicine, the patient needs to be in the state of the physician. So yes, unless if your licensure allows you to do that. Marshall, I'll let you elaborate. I know that we addressed this a bit earlier.
Yeah, in most cases, the work we're seeing is doctors reaching out to their patients who are local, and that's covered. But if they need to go across state lines, they will have coverage if they're licensed in those other states for the most part. But there are a few states where they have different requirements for insurance coverage that your TMLT policy might not fit. So in those cases, we'd ask you to reach out to your underwriter, just visit with them and see how your situation fits, and we can take that from there.
And actually, the last question is, what is the difference between a telemedicine consult and the typical short phone call that we've done for years? I would say in the telemedicine section, one of the slides we referenced was a Medicare frequently asked question, and there is some detail in that document. I think one of the biggest differences is the potential to actually bill for those short phone calls as being a telehealth or telemedicine type of visit during this pandemic. But again, as we've said multiple times, whatever you're doing by whatever means, document, document, document. Make sure that anything that you are using to make a medical recommendation or a medical decision making is documented, because that's going to be your best defense.
Kathy, I'm just going to jump back. You may have answered this, and I didn't hear about WhatsApp being a platform for telemedicine. Did you answer that?
I did not see WhatsApp specifically listed in the OCR guidance.
I believe that they have listed WhatsApps into a publication that they released just recently, as far as Apple FaceTime, Facebook Messenger, Google Hangouts, WhatsApp video chat, or Skype. So I just wanted to see if we had answered that and make sure that that question was responded to.
And WhatsApp does have some protections, if you will, from the way that they transmit their information. It is encrypted. Normally, you would not use WhatsApp because just a small provider would not be able to get WhatsApp to sign a business associate agreement. But at this time, that is waived during the pandemic. Final thoughts, since we have no more questions. Final thoughts, Mark?
I guess a couple of things. It's been mentioned several times during this presentation to document the care you're rendering during this time. I think that's really important, and we can't emphasize it enough. And I guess lastly for me, I want to thank everybody for taking their time and visiting with us today. And I know everybody's got a lot of work right now, and we really do appreciate everything that our doctors and nurses and administrative staff people are doing right now.
Thanks. David, what about you?
Yeah, echo Marshall's comments. We do thank everyone not only for coming today, but also for everything you're doing out there. So important, obviously, and causes everyone involved a lot of concern for their own health. And we just want you to know we appreciate it. And if there's anything we can do on the claims side, if you have claims that come in or have claims questions, even if you get subpoenas or requests for depositions or meetings with attorneys, please call the 800 number and speak to someone in claims, and we'd be happy to help you.
Yeah, as David and Marshall have said, we really do thank you all for the work that you're doing out on the front lines. We know that this is uncharted territory, and however best we can serve you, please don't hesitate to reach out to us. We may not know the answers. There are a lot of moving targets, but we'll do our best to try to get you into the right place to find an answer to your questions. And we just appreciate your time today, and everybody be well.
I would just like to echo the same sentiments. I have been a nurse for many, many years, and I do not envy any of you on the front lines as healthcare providers, whether it's in your office, in a facility, trying to take care of patients in this very difficult time. So please feel free to reach out as we are here to help you try to figure out some of these uncharted waters. As well as, if you have questions, feel free to email them back to TMLT. And we hope that as information evolves, we'll be keeping it up on our website or potentially doing other webinars to help get your questions answered. Thank you for joining. You will be receiving a link to today's recorded webinar. You may feel free to share that with your colleagues. And hopefully we'll be back on our regular schedule in April, where we'll be talking about cyber liability. Thank you all again for joining us.